Greetings. My name is Dr. Keith Boyd. In this session, we're going to review the basic principles of clinical ethics. Those include autonomy, beneficence, non-maleficence, and justice. And I like to add utility. Let's start with the educational objectives. Here they are. Name and define the four fundamental principles of clinical ethics: autonomy, beneficence, non-maleficence, and justice. Define utility as the term applies to clinical ethics. Provide examples of the application of each principle to a case. Finally, describe the meaning of a conflict between the principles. First, let's go over a few items of introduction. Medical ethics is an applied branch of ethics. That is to say, it's a branch of ethics which focuses on the application of concepts, in this case, to authentic clinical cases. Medical ethics is the practice of analyzing clinical medicine and scientific research to ensure that certain principles are followed. Commonly in clinical practice, we know that the patient and the practitioner are faced with many choices. Usually, these choices don't have any significant ethical implications, or the ethical implications are minor. But sometimes, these decisions have significant ethical implications. And ideally, for any decision to be considered ethical, the decision must be consistent with all four of the fundamental principles of clinical ethics that we've already listed. So in all situations, the four principles should be considered. However, what you'll find in clinical practice is that usually one or two of the principles are most relevant or have greater relevance than the others. In some cases, you'll find relevance to all of the principles. The four principles are valued equally. They're not in any sort of rank order of importance. However, as we'll talk in a minute, the values of the patient should guide the relative ranking of the principles or the application of those principles. The purpose of all this is to allow care providers and families to create a treatment plan and work toward a common goal. We'll talk quite a bit more about utility, but this is an additional principle that's worth considering in some cases. So let's start by defining each principle, and then we'll return to looking at utility. Before proceeding, I need to say a quick word about capacity. I encourage students to use the term capacity as opposed to competence when describing a patient's ability to make a decision. Competence implies some sort of judicial proceeding, whereas capacity to make a decision is an assessment that care providers can make. As we define these principles and apply examples, in every case we're going to assume that the patient has the capacity to decide. That is to say that the patient has the ability to make an informed decision. The details on decisional capacity are covered in another video. I like to interpret autonomy through the business adage, the customer is always right. That is to say that a patient with decisional capacity has the right to make whatever decision they feel is best for them. This is a reflection of the patient's right to self-determination and is often held above all other principles. The patient's decision must be free of coercion and coaxing and must reflect the patient's values as opposed to those of the provider. Autonomy is the basis for the practice of informed consent, the process through which patients make informed choices and express their values in developing a treatment plan with their provider. And in the culture of medical practice in the United States, autonomy is the principle that should prevail in most cases. When there's a conflict, autonomy should take precedence. The healthcare provider's chief objective is to help the patient and benefit society as a whole. This is an expression of beneficence. The primary intent of any action must be to benefit the individual patient. Simply expressed, this is the principle that ensures that acts are doing good. The results of a decision lead to good for the patient. Non-maleficence is best represented by the phrase, "First, do no harm." This is a critical commitment that healthcare professionals have to their patients to protect them from harm. Most practitioners would consider this principle second only to autonomy. Some might even consider adhering to non-maleficence more important than respecting autonomy if, in the situation, it's interpreted that respecting autonomy might lead to harm to the patient. Non-maleficence is a constant duty, whereas beneficence is a limited duty. That is to say that one is beneficent whenever possible, but one must never do harm. Let's talk a little bit about justice. In clinical ethics, this has a different meaning than the meaning that most of us are exposed to on a daily basis. Justice that we talk about on a daily basis usually refers to situations that have legal implications. So in clinical ethics, when we talk about the principle of justice and consider its meaning, it's different than when we apply it to examples where someone might break the law. In clinical ethics, justice is best described as fairness, the fair distribution of scarce resources or the fair treatment of patients who have similar needs. Justice in clinical ethics means that the burdens and benefits of a decision must be distributed fairly among groups. Those are equal groups, so it requires us to define that group. This implies that there's a fair distribution of goods and services to those with equal need. Example of patients who are considered equals would include patients with the same disease at the same stage. These patients should all receive equal treatment. But as I mentioned, this requires us to define the group to which we're referring to in a specific situation. Let's talk a little bit about that additional principle that I like to include, utility. This principle was not included in the original description of the ethical principles, largely because the original principles describe situations that involve a single patient and a provider. Because utility covers elements that are not addressed by the other principles, it is an important consideration in some situations, especially those situations in which there might be significant impact upon larger populations beyond the individual patient. Utility is applied by seeking the greatest benefit to as many people as possible. So in contrast to the other principles that we've discussed, utility considers a population as opposed to just the individual patient. So when we look at the original 4 principles that we discussed, these usually are considered in a decision that involves one patient that does not have significant implication for others. However, in some situations, there may be important considerations regarding other patients that go beyond just the one patient. And there are implications for a population that are important to consider. This is when we need to consider the principle of utility. So remember, these fundamental principles are non-hierarchical, meaning that no one principle is routinely overruling another. No one principle has greater value than the other. Although, again, as a reminder, the individual patient may value the outcome guided by one principle over another. In the analysis of an ethical problem, we need to consider all of the principles. However, depending upon the situation, one principle might seem more important than another. As you're applying the principles to a specific case, if the outcome dictated by the application of each of the principles points in the same direction, you have no conflict. No conflict, no problem. When two or more principles apply to a case, the results directed by following one principle might conflict with the results of the following of another. When this conflict arises between principles, one must consider the patient's values and how those should weight the conflict. In other words, might the patient value one principle or another in a specific case or a specific decision? That principle then should take priority over others. There are a few additional important considerations. In the United States, we live in a pluralistic and multicultural society. Different people have different values. An interpretation of these fundamental principles of ethics in a specific case must be based on the patient's values, not our own. So let's practice applying each of the principles to a couple cases. Here's the first case. This case involves the children of Richard Archer and Marissa Castle. It occurred in 2015. The two adults in the case were an unmarried couple. They had two children, ages 2 and 4. This case was tried in a Connecticut trial court, and each parent was seeking a restraining order against the other. The two had a long history of disputes that involved many different areas, but this case revolved around the mother's religious objection to immunizing the two children. To help resolve the case, the court appointed a guardian ad litem to represent the interests of the children. A quick sidebar about the term guardian ad litem. This individual is appointed by the court to investigate what solutions would be in the best interest of a child involved in the litigation. The guardian ad litem is charged with carefully examining the various options and making assessments based on the best interests of the child. The guardian ad litem then advises the court on the options. So let's apply the principles to this case. For autonomy, the parents are usually the decision makers when it comes to medical decisions for their children. Parents are assumed to represent the best interests of their children. However, if the decision of the parents is judged to be not in line with accepted medical practices, the state may take action to ensure the health of the children. In other words, the state may take medical custody of the children in order to ensure that an appropriate medical decision in the best interest of the children is made. For beneficence, one might argue that immunizations have been shown to be one of the greatest developments of modern medicine and are very effective in preventing disease. For non-maleficence, it must be pointed out that any vaccine given to an individual might actually cause harm to that individual in one of many possible ways. A partial list includes an adverse reaction, including an allergic reaction, depending upon the type, may be quite serious, or pain at the injection site, or a variety of symptoms that may mimic the symptoms of the disease. So immunizations are not without harm to the individual patient. In this case, it's important to consider utility. Remember that the principle of utility is trying to achieve the maximum benefit for the most number of people. Immunizations protect the individual, but also protect those the individual encounters. Immunizations maximize their benefit for all by preventing disease in individuals, as well as helping to prevent the spread of disease to others through the development of herd immunity. In the end, the result of the legal case was that the court awarded the father the authority to make healthcare decisions for the two children, and they were immunized. Let's look at another case. This is the case of Brittany Maynard from 2014. Brittany was a 29-year-old woman. She had advanced brain cancer and was experiencing significant complications of the disease, which included seizures, severe head and neck pain, and symptoms that were like she was having a stroke. She chose to end her life by physician-assisted death, which was allowed by the 1997 Oregon Death with Dignity Act. This act permits adults with terminal illness to voluntarily end their lives by taking a lethal dose of a medication. Before her death, Maynard said that her choice to die was not a suicide. In her words, "I'm not killing myself, cancer is killing me." However, in a New York Times op-ed, a physician wrote, quote, "When doctor-induced death becomes an accepted response to the suffering of dying people, logical extensions grease the slippery slope." End quote. Meaning that there's the possibility that if we allow physicians to participate in assisting death, that puts those individuals on a slope where it's hard to grab on and prevent potential abuses of the practice. Before we go on to look at the application of principles to this case, I think it's important to note that both supporters and opponents of physician-assisted death share a commitment to care, compassion, respect for the patient, and dignity. Autonomy is, as it should be, the first consideration, as a reflection of the patient's right to self-determination. So whenever possible, a patient's choice should be respected, irrespective of the practitioner's judgment. In this case, beneficence may be interpreted as the relief of suffering. Non-maleficence, as a reminder, is the first and foremost duty of the practitioner to do no harm. So assisting a patient in hastening their death is inconsistent with this principle. Many argue that physicians have a duty to preserve life and believe that physician assistance in death undermines the public trust in physicians, disrupting the core values represented by the physician-patient relationship. The American Medical Association opposes physician-assisted suicide, stating, quote, "Physician-assisted suicide is fundamentally incompatible with the physician's role as healer," end quote. In the end, Maynard ended her life surrounded by her loved ones in accordance with Oregon state law. Brain tumor was listed as the official cause of death on her death certificate. Maynard wrote in her final online post, quote, "Today is the day I have chosen to pass away with dignity in the face of my terminal illness. This terrible brain cancer has taken so much from me, but would have taken so much more." So let's take a moment to return to the educational objectives and see how you've done. So you should be able to name and define the 4 principles of clinical ethics as they've been defined: autonomy, beneficence, non-maleficence, and justice. You should be able to define utility as a term that also applies to clinical ethics in particular cases that involve population impact. You should be able to provide examples of the application of the principles to specific cases And you should be able to describe the meaning of a conflict between the principals and additionally how that might be resolved. Here are the references for this video, and I hope you found it useful. Thanks for watching.